Hi, in this video, I'm going to talk about how you use the Smart Inbox in your practice. There are two ways you can use the Smart Inbox in your practice, and the first way is you use it as a processing tool. The second way is you use it as a triage tool. And in this video, I'm going to talk about how you can complete and save eConsults into your clinical system using both processes. One of the ways you can access the Smart Inbox is via the eConsult toolbar, and you can see the envelope icon there, which is the Smart Inbox. Before I show you how you can complete and save an eConsult into the clinical system, I want to give you a very quick tour of the Smart Inbox. On the left-hand side, we have the navigation pane. Starting from the top, we have the All Open folder. This is where all your eConsults that haven't yet been closed will sit. We have the flagged urgent. This is an opt-in feature, so your practice may not have this feature on. Then we have the complete folder, which is where all the completed eConsults goes. Beneath that, we have the two big folders, which are the clinical folder and the admin folder. All the clinical eConsults will automatically go into the clinical folder, and all the admin eConsults will automatically go into the admin folder. Starting from the top, we have the waiting folder, which is where all the new eConsults will go into. And then we have the snooze folder, which is where eConsults that you choose to snooze for yourself will go into. And then we have the awaiting response. Via the Smart Inbox, you have the option to send a patient a message and allow them reply. If you chose that feature, that option, then the eConsult will go into the awaiting response folder. The new response is where the eConsult goes, where the patient replies, and then the triage folder, where we'll cover when we talk about how you use the Smart Inbox. Moving to the right, we have the eConsult cards, individual cards, which you can see on the screen. On each of the cards, you can see the name of the patient, their age, the condition they've completed, and if they have any flags attached to them. When we speak to practices, our advice is if you have very few eConsult, then of course you can work from the top to the bottom. But you could also sort the eConsult so that you deal with the eConsult with the most flags first, or you could choose to deal with the children first or the elderly first, but you have the option to change the view. Going now to each of the cards, after you view the card on the right-hand side, we have the actual eConsult. This is where you find the condition they've provided, the patient's details, and the questions that they've answered. And then on the far right, you have the signpost area where you can then save and change the status of your eConsult. Now I'm going to go through how you can save and complete an eConsult in the clinical system if you use the Smart Inbox as a processing tool. This means that the admin team will log into the Smart Inbox, they add the patient to the appointment book, and they save and complete the eConsult in the Smart Inbox. In that case, I simply highlight the eConsult that I want to process. I open the mashed field so that I can access the patient's record and add that patient to the appointment book. And then I simply go to the right-hand side and change the status from waiting to complete, and then I save. That will immediately save all the eConsult and all the activity on that eConsult into the patient's clinical system. I'm now going to show you how you can complete and save an eConsult to the patient's record in your clinical system when you use the Smart Inbox as a triage tool. You start from the waiting folder within the clinical folder. You select the eConsult you wish to triage, you review, and then you move over to the signposting area and select a team. And then you can select an urgency and you can select a mode. And then you move over to the status area and change the status from waiting to triage. Once you click save, this eConsult will be moved into the triage folder. You could also use our tagging feature, which enables you to tag a specific person or a specific service. And so I'll save, and this eConsult will move into the triage folder. The member of staff going to complete the eConsult will start from the triage folder. You select the eConsult you wish to complete to review the actions that need to be carried out, and simply move over to the status area and change the status from triage to complete. And then you save. When you click save, all the activity will be saved into the patient's record in your clinical system.